Hello, I'm Dr. Jon Steinberg. I'm a consultant psychiatrist and I'm the medical director of the Caloundra Private Clinic, and I'm a consultant psychiatrist at the New Farm Clinic, which are both Ramsay healthcare facilities. Today I am here to talk about old age psychiatry. It's important for people who are worried that they have a depressive illness to try and get some assistance as soon as possible. Now, first they might talk to their family or their loved ones about how they're feeling, which is important because they can get some support from them, and also their loved ones or relatives can give an opinion about how they're going and whether they think they've got a depressive illness. But it's very important that they should speak up as soon as possible to their doctor or their healthcare provider if they're concerned that they have a depressive illness. Usually we think of depressive illness as lasting for 2 weeks or more. So I think if you're suffering those symptoms of depressive illness for more than a few weeks, it's very important you speak to your psychiatrist. But having said that, if you had suicidal thoughts, you should really talk to your GP or healthcare provider, or contact, some people even ring Lifeline or one of these organisations that offers support and guidance about getting treatment as soon as possible, even going to a public hospital as soon as possible if you felt suicidal. So if it's urgent, if you don't feel life's worth living and if you're suicidal, go as quickly as possible to get help. If you develop depression in older age, that can be sometimes different to depression or depressive illness in younger people. Some of the things you might be concerned about if you're depressed in older age is the life events you've experienced when you're older. So you might have retired from work, you might not have as many interests, and sometimes your depression might show up in the fact you can't find new interests or you can't find anything enjoyable as you get older. So it's a change of lifestyle when you get older that happens, and you get miserable about it, or you get sad about it, and you can't start new things. I think that's a very important factor. Can't find new things that you enjoy. The other factor in older age is that you might be developing physical illness, such as arthritis or cardiovascular, heart problems, or you might have these conditions and you might lose interest in getting help for them, or you might be pessimistic about your outcome. So instead of going to see your GP, you might say, well, I'm not sure this will get better, so I won't get help. So it's very important to ask that question. Are you motivated to get help, and have you lost interest in your own health? And the other thing that happens in old age, we lose people because people get older, our spouses get older, our relatives get older, our friends get older, and we might be worried about, overly concerned about losing our friends or our family members, and perhaps sometimes the grief goes on a bit. Grief's normal, everyone grieves when they lose people, but the grief goes on longer than we think it should. Or if you think it's going on longer than it should, then you should be aware maybe that's a sign of depression in older age, and it's important you talk to your GP about it, talk to your family and see whether they think you're coping with the grief. So if you think your grief after you've lost a relative is going on for too long, it's important that you maybe talk to your family first, but also talk to your treating GP and discuss with them whether they think you also have a depressive illness, which is making your grief worse than it should be. And it is important, if you have suicidal ideas in older age, to talk to your GP or talk to someone as soon as possible about that Lifeline or public hospital system to get help as soon as possible. Anxiety is an experience everybody has. It's basically the physical manifestation of fear. So if you're frightened of something, you may feel you're anxious. In older age, anxiety can be present in life. We can all feel anxious about certain scenarios in life. So in older age, it's normal to have anxiety in certain situations. Some people who are older had anxiety when they were younger. Some people develop anxiety as they get older, perhaps because of changing events in their life, such as retirement, such as moving house, downsizing house, financial concerns as they get older. They might be, people in their environment might be unwell, they might be really worried about them, and they might get fearful about their relative or friend's health. They might also be worried about their own health. So as they get older, they lose physical function, and they wonder how they're going to cope with that. So they become anxious and fearful about how they're going to cope with their bad arthritis, or how they're going to cope with pain as they get older, or if they develop a severe illness, such maybe even they might have cancer as they get older, so they might get worried about how treatable their illness is. And they would get fearful about the outcome of their health. So there are many changes as you get older that in life, stressful events, that can cause you to be anxious. And if you're anxious, that can be fine and normal, but if you get anxious to the point of not wanting to do something that you normally should be doing, such as seeing your friends or going out and enjoying yourself, perhaps that's a time you might actually talk to your doctor about it, or try and get some help, because perhaps you could have an anxiety condition which is treatable, and therefore you can get back to enjoying your life.